Hello, good afternoon, good morning, good evening, and welcome to episode 47. Had to think about it again then. Right, for some reason, I don't know why, but it's great. A lot of my channels on the socials, particularly Facebook, has gone a bit bananas recently. So I thought, as a welcome to all you new followers and new subscribers, whichever platform you're on, I thought I'd give you a bit of a treat. And there are 6 ears in this compilation today. And in the middle of this, there's a story that I wanted to share with you. That I'll be honest, it got me. That's why the title of the video. It got me quite emotional. And I normally have a bit of a swinging brick me for a heart, but there is one inside there somewhere, and it really touched me. So I just wanted to share it with you because it really was part of the reason why we do this job. Or certainly why I do this job. But the first one here, a gentleman who came to see me, not totally blocked, but not far off. And it's quite, the majority of this is dead skin that's failed to migrate out the ear, which is supposed to. And it's really, really deep inside the ear. You can just see the eardrum in the distance there. And when it's this deep inside the ear, and when it's a bit more delicate work that you're having to do, I'm having to use the fine end tip, which is a little adapter that put on the end of the suction tube. And it's a lot narrower. It gives you better visibility. It's why it looks a lot smaller in the canal. That makes it easier to see what you're doing. Comes with a bit less power, but it's handy when it's a bit deeper down in the ear like this for getting these most of it dead skin ribbons away. So I've already managed to get a few there. I'm going to save the big one till last. That'll work my way down. So yeah, the one in the middle, though, stay tuned for that. It's not actually recorded. It's just a quick story of a young boy who came to see me. And yeah, but stay tuned for that. It's after these next 2 or 3 years, I think. But this one was fairly routine, this one. I just pulled out another little chunk there, and I'm going to go in and try and get the bigger one. No, I'm not. I'm going to try and get that one on the side first. I can't remember. I've seen a lot of ears recently. This was just one of them. But that's why I thought I'd decide to share so many with you. I thought, why not? Bit of a treat. And I'm at home today. I've not booked anybody in today. I thought I'll have a day off. I need a bit of a rest because it's been really busy. But whilst there's been so many new followers, I thought, yeah, let's treat you. Hopefully you can hear me okay anyway, because I didn't bring me, I usually wear a microphone on there, so I'm just recording it to the actual camera itself without the microphone. But hopefully you can hear me still fine anyway. So there it is. We've got the last little lump out of there, or a bigger lump, should I say. And yeah, you certainly noticed a bit of a difference after this one. And there it is, nice and clean and clear. I'm not too concerned about that little flake at the top. Next one. Now, I wish they all went like this. You'll see it might just steam up in a second before we cut away. You can get a bit of condensation on the camera sometimes when the air there is warmer than it is on the other side of it, but just grab it and pull it out. I wish they all went like that. Now have a look at this. You get a bit of a rainbow wax here. You can see it's lighter at the bottom and darker at the top. So that shows the different stages of the skin shedding as it's slowly dying, it gets slowly darker. And this was the other ear of the lady question, who it wasn't completely blocked. But I thought we'll just get rid of this bit of skin here because it's going to it'll probably end up like the other one soon enough. Truth be told, I probably should have got in with a fine end tip here rather than the big one, because it did squeak a little bit, which is why you see me kind of coming away from it with it, reluctant to go down the middle, because when you have a flap of skin like that, before it comes out, it can violently squeak and make a bit of a squeal. It didn't. It was just a tiny little bit of a squeak, and out it popped. And get a nice shot of the eardrum there, all the way down there. It's nice and clear, and there they are. Not huge, but big enough to be affecting this lady, because they were quite narrow. Her ear canals are a bit like that, so it doesn't take much to block them up at all. And then the next one, right, this is my new favourite patient. He's Taylor, and he's 4 years old, and his mum was having terrible trouble trying to find someone to treat him. It had been going on for months and months and months, if not longer, to be honest. And that's what he had in his ear. And couldn't find anybody to treat him. The NHS, bless them, they're trying as hard as they can, but they just can't fit everybody in, unfortunately. Now, to get him in, his mum told him that I was Spider-Man's best friend, because of my microscopes on my eyes, it made me look like this thing here, which is apparently a spider bot. And that's what we pulled out of his ear. And you'll just see in a second, it's nice and clear afterwards. But because it had been blocked for so long, his development was starting to be affected, where he couldn't speak properly, he couldn't form his words properly. and I obviously couldn't hear anybody, and it was having a huge impact on his life, and obviously on his parents as well. But as soon as we did it, he spoke clearly, and he answered questions which he'd not done before, and me and his mum were quite taken aback by the difference in his speech afterwards. It was literally life-changing, and yeah, it did get me quite emotional afterwards. After they left, I didn't tell her this, but it really touched me how something so relatively straightforward can affect someone's life. And yeah, it almost made me well up. Not quite, but it almost made me well up. And if you want to check out what his mum said, I think you can find some reviews. I think I posted them on my Facebook page. It was just really nice and touching what she said. Anyway, what you've just seen there while I've been babbling on is more cotton bud abuse. Not use, abuse. They caused little grazes in the ear, and then got some dried blood on them, which managed to peel off. Thankfully, they were healed underneath. But yeah, they're not supposed to be in your ears. Don't put them in there. That's not what they're for. And you know, you can get infections, bleeding, bruises. Thankfully, this lady got away with it, and it was okay in the end. But it's a good example of the kind of damage that you can cause by putting these buds in your ear. It's not what they're for. Stop it. Right, and this last one for the purist, this one, because I'll be honest, it's a difficult watch. It was even more difficult to do. It was actually the son of the second and third ears, if I'm not mistaken. So he's a regular of mine, and I'll be honest, I'm not going to lie, when I see his name pop up on the list, I think, oh no. And you can see why. It's a proper jungle in there. It is really, really hairy. Now, we all have hairs in our ears. This chap has a lot more than most, and it makes it really difficult to see. So it's difficult to see for me. It's obviously difficult for you to watch like that, but I just wanted to put it on to show you that they're not all easy. They're all very different and very difficult for different reasons. And you'll see there's a bit of a glare. So because it's that dark and dense in there, you have to turn the brightness up on the camera to actually see the wax to start with. But what that does, it reflects off the hairs and the skin at the side, makes it glare a bit. But without it, I wouldn't be able to see what I'm doing. I'll be honest, sometimes you can't see what you're doing anyway. It's a bit of an educated guess. Having done it for years, you kind of got a rough idea whereabouts you are. But yeah, there is a bit of educated guessing going on with. I think I'm around about here now, but it was very close to the outside, so I wasn't needing to go particularly deep. So it's still fairly safe to do. But because there's this many hairs, you can see what they're doing. The hairs are actually disappearing up the tube. You've got this bundle of hairs trying to fly up the tube, and it actually can affect the suction power if you've got all these things up there, because it creates like little air pockets around them, so you don't get a tight seal on it. But I'm very stubborn, as Taylor's mum will vouch for, and it gave way. It gave way in the end, and I'll be honest, it was a bit of a surprise, this one. A nice big wax baby after a little tricky ear labour, and yeah, there it is. It's a big one. But anyway, thanks for watching those. Thanks to all you new followers. Don't forget, you've got another 46 odd episodes to play your way through. So feel free to go back and watch all of them. And if you like any of them, then tell me. Leave me a comment or a heart. Feel free to subscribe to any channels. And if you want to send my mate Taylor a message, I'm sure his mum would appreciate that as well. So if you leave some down below. And I'm sure, oh, by the way, yeah, his mum messaged me this morning, actually the morning afterwards, and he said the first thing he did when he woke up, he said, "Mum, I can hear the birds tweeting." And again, that just welled me up again a little bit there. Made me realise that I'm in the right job. Anyway, I hope you enjoyed that. But for now, take care of yourselves, and I will see you soon. Bye-bye.